Hello friends, good morning. Today there is a very interesting topic called narcolepsy or excessive sleepiness, excessive daytime sleepiness. I have seen a quite number of patients or persons who comes to me with excessive sleepiness. They doze off whenever they are eating, when they are in conversation, whenever they are driving or doing some work. Sometimes they would land up in accidents. And it's so disturbing that it would affect his personal, his family, his social and occupational life, especially drivers. I've seen a person who has just hit some other person on the rear side, and especially they used to doze off at the signals when he stopped the vehicle for maybe a few seconds or less than a minute. He tends to doze off, and it's a so disturbing fact. So you know that this condition called narcolepsy, or it is characterized by excessive sleepiness, more and more sleep, and sometimes they would get sorts of hallucinations whenever they are entering into the sleep phase. They would they experience some out of body experience, something like flying or falling off, or some various hallucination, visual hallucination or auditory hallucination or somatosensory hallucination. And whenever they are getting up from or waking up from sleep, they get another sort of hallucination, hypnopompic hallucination. And sometimes when they are entering, they are getting up in the morning, or maybe at the outset of the sleep also, there would be something like a paralysis called sleep paralysis. They would be fully awake but won't be able to open eyes, speak or move the limbs. They will remain like that for maybe up to 2 minutes, and will be so frightful that they would think that they have already died or something like that, unless somebody calls them, or this improves within a matter of 1 to 2 minutes. This is called a sleep paralysis. This is also part of this syndrome called narcolepsy. Sometimes they fall off to the ground when they are stressed, when they are happy, or when they are emotionally disturbed, when they are suppressed. It's called cataplexy, sudden fall, sudden dropping of the jaw, sudden closing of the eyes, or whenever they used to laugh and fall off to the ground. This is called a cataplexy. That's also part of this particular condition called a narcolepsy. This sometimes runs in families up to 10%, and the occurrence of this condition around 10 to 50 per lakh. So, I have seen quite a number of patients with a narcolepsy, especially young people. Whenever they are in the class or in the doing something, they used to doze off, and they sleep for maybe 5 to 10 minutes, and immediately they get up fresh without much. After some time, maybe half an hour, 1 hour later, again doze off, and whenever they take a nap for 5 to 10 minutes, they are fully okay. So this because their nighttime sleep will be disturbed, so they'll be needing for more and more daytime short naps. Okay, actually this is a problem with one area of the brain called hypothalamus, the one end of the hypothalamus, lateral hypothalamus, where there is a decreased production of some hormones called orexins or hypocretins. Okay, so whenever this neurotransmitter is low, they tend to doze off, they tend to have increased sleepiness, and apart from that nothing will be there. It is not related to epilepsy, it is not related to stroke, that is not related to any psychiatric manifestations. So it is not a psychosis, it is not a depression, it is not a dementia, nothing like that. This is a sleep disorder, some genetic sleep disorder. Sometimes you have to roll out other conditions, as I mentioned, epilepsy, but of course epilepsy will have other manifestation, like they'll be having some jerk or something, loss of consciousness. Here person will be fully conscious, but apart from the sleep, they'll be normal. Okay, all the investigations, all the scan, everything will be normal, and the history will be so classical, and maybe some of his family members are also affected by this particular condition. May they are having some other problem like depression, migraine, or they will have other sleep abnormality, or other leg movements during sleep. These are all part of this condition, may be associated. But of course, there are other conditions in the brain like stroke, encephalitis, head trauma, tumors, many genetic illnesses, neurometabolic disorders, or encephalitis, or neurosarcoidosis, or some other infection would also lead to this particular condition, but it is not narcolepsy. Even alcohol, high doses, alcohol can also give us excessive sleepiness. Many drugs or substance abuse can also lead to this particular condition. So, how do you know that this narcolepsy? The most important is the history. The patient would tell you that he dozes off whenever he is in conversation, when he is driving, whenever he just sit and read some books or something. So, one is the excessive sleepiness. Secondly, his investigation would be normal, but of course, we have to rule out other conditions like anemia, severe anemia, liver problem, heart problem, lung problem, any substance abuse or drug intake, alcohol, hypothyroidism, or other problem in the brain. So, you may need a scan, maybe MRI scan, an EEG to rule out a seizure disorder, thyroid function test to rule out a hypothyroidism or some other endocrinopathies, blood tests like anemia and all. And of course, the real time diagnosis would be doing something called a polysomnography. That means you admit the patient and do this one test called a PSG or polysomnography, where we would examine the brain function by EEG, the eye movements electrocardiogram, as well as the EMG, surface EMG, the pulse oximetry, the respiration, leg movements, everything will be will be the admit and see what is happening to the respiration, the eye movements, the EEG abnormality, the EMG, leg movements, oximetry, everything will be included in that in the PSG. Secondly, there is one more test called MSLT or multiple sleep latency test, because you know that whenever you are going to sleep, the stages are first you will be normal, then you will be drowsy, then this would go into various stages like stage 1, 2, 3, 4 like that. Then after that you get something called a REM sleep, where you would have fast eye movement, the eye would roll to either side. During that time patient will be atonic, the limbs will be flaccid and you would experience dreams, all the dreams. Okay. So, what have there is one particular condition called REM behavioral disorder. During instead of the atonicity, I mean the muscles are flaccid, the muscle will be active. During that time, these people will thrash, kick and jump and do all sort of things whenever they are having some dreams. Suppose if they are a footballer, they would kick off the partner or the somebody who's lying aside him. So that's a different condition called REM behavioral disorder. Here that is very extremely rare in REM behavioral, I mean in the narcolepsy. So of course you have to rule out all other conditions like epilepsy, stroke, TIA, psychiatric illness, drug abuse, alcohol, etc. Then other thing is there is one HLA association, is HLA DQ B1602 is associated with this CSF. If you remove some fluid from the back of the CSF study, some hormone will be less, like orexin will be low. The treatment would be you should have a sleep hygiene. You should have a sleep diary. So what is the time you are going to sleep, whether you have lost sleep. So everything should be recorded. And you should avoid tea, coffee, alcohol in the evening, do regular exercise. And there are many drugs like various stimulants are available in order to prevent the daytime excessive sleepiness. Okay, of course you have to reduce your weight, you have to avoid snoring and obstructive sleep apnea. All other medical comorbidities has to be treated. So basically narcolepsy is a benign condition, except that this would cause sort of excessive daytime sleepiness, this sort of arousal and this sort of hallucination while going into sleep or getting out of the sleep. Sometimes you go to a sleep paralysis or cataplexy, sudden fall to the ground or sudden jaw drop or something like that. So this is in short regarding narcolepsy or what's happening in narcolepsy. This is only just a tip of the iceberg. There are many disorders related to sleep. Maybe we can talk on this topic maybe at a later time regarding REM behavioral disorder, sleepwalking, sleep paralysis and other sleep terrors and all. Thank you very much. Bye.